Hello students, so today we are going to discuss about this typhoid. You will be getting the lectures of that environment chapter soon. The part 3 of it is coming out, but this is a new series of video lectures in which we'll be discussing about the different diseases, their overview, their symptoms, their prevention, their impact and their spread, how they spread and other things. So in this video we are going to see about the overview of typhoid. So this typhoid fever is caused by an organism that is known as Salmonella typhi. Typhoid fever is rare in industrialized countries, like in highly developed countries. This typhoid fever is not as concern, but in case of developing countries like India, typhoid is a great concern. It generally gets spread from one organism to another using contaminated food and water, and the symptoms are regular symptoms of this disease are high fever, headache, and abdominal pain. Most of the people who are having this typhoid fever, if they are treated correctly with antibiotics, they may feel better in 2 to 3 days or in few weeks. But if the complications are very high, then this condition can be a life-threatening one. Now, what are the symptoms of this disease? The signs and symptoms involves different things. It can be divided into two different categories. One is early illness and the second one is later illness. In case of the early illness, the disease typhoid shows the different kinds of symptoms like weakenings, fatigue, uh, dry cough, loss of appetite. But one of the most important symptom is having fever, which is more than 40 degrees centigrade or 104.7 or 104.9 degree Fahrenheit. So these temperatures, these high temperatures are the symptoms of early illness. The next one is later illness stage. In this later illness stage, the conditions becomes very much deteriorous. In these conditions, the person feels exhausted, they become motionless, their eyes remain half closed. So this stage of typhoid is a life-threatening stage. In this stage, the complications are very high, and generally the patient goes out from the doctor's hand. The third thing what we should talk about is prevention. In developing nations, they have developed different antibiotics for this disease. They have a safe drinking water system, they have improved the sanitation purpose, they have adequate medical care for those developing nations. But for other countries, this where the condition of typhoid is very threatening, in those places we generally send vaccines which are used for the treatment of this typhoid fever. A vaccine is recommended if you are moving from a highly posh area in a developed country. From a developed country you're moving to a nation in where the cause or the spread of this typhoid is very high, you are generally vaccinated before we reach that place. Next comes, what is the impact of this typhoid? This typhoid has a very bad impact on the human's body. It causes intestinal bleedings, it causes perforations in it, and hence inflammations takes place. It causes severe abdominal pain, it causes vomiting, it causes sepsis or blood infection, bloodstream infection. Sepsis occurs here. If these conditions are life-threatening conditions, other than these, the smaller or some other impacts, what we can say, the other complications related to this typhoid we can say are heart muscle inflammation, that is known as myocarditis. It can be heart and valve lining inflammation, which is known as endocarditis. It can cause pneumonia, it can show pancreatitis, it can show meningitis, it can show paranoid activities, psychiatric problem, and many other things. So it is a very dreadous disease to deal with. Next, how does it spreads from one organism to another? It generally, what I have said, these things are not a concern for the developed country where they have a safe drinking water system, they have perfect sanitation. This disease is seen in developing countries where the sanitation purpose is not that good, or in those countries which are rural countries. So in those cases, this typhoid is seen in a devastating way. They encounter a huge bad thing of typhoid. And the most important route for transmission of this typhoid is fecal and oral matters. Whenever we are discussing about drawback country, a country which is just developing, or a weak country which is rural, in those cases the literacy is not that high, and the people out there are not properly sanitized, they don't wash their hands after going to washroom, and hence they pass those things from one organism to another, from one human being to another. and hence it is one of the most important routes of transmissions of this typhoid disease. Typhoid carrier, who are the typhoid carriers? Small number of people who are recovered from typhoid fever can also contain the bacteria inside their body. If those human beings comes in contact with other human beings, then they can easily transfer their disease to the other organism. Now, what are the do's and don'ts of these disease? How can we get prevented from these disease? Number one, if you are recovering from the typhoid fever, these measures must be kept in your mind. Number one, take your antibiotics. The most important thing, the doctors gives antibiotic, the doctors gives medicine. He has studied a lot. When he is giving a medicine, make sure you eat that or take that medicine, because it is important for you. Second thing, you should wash your hands often. Third thing, avoid handling different kind of foods or any kind of thing. Whatever different things you are using, whatever different substances you are taking, after using anything, after handling anything, make sure you sanitize yourself very well. Make sure you wash your hands very well. Mm, and every often you should do this one in order to keep you safe from this typhoid. Just like this typhoid, we have all one pandemic going on right now also. You know that name very well. The name of that virus is coronavirus. So you have to be safe from all these unwanted virus, unwanted bacteria in the same way or the other. You have to keep yourself safe by keeping yourself sanitized, and if you have a medicine, then take that medicine and it will keep you healthy. So this sums up today's lecture. In this lecture, you might be thinking that why am I giving these series of lectures? You have a chapter in your class 12 that is human health and diseases. In that chapter, you have a brief overview of these diseases, but no one says about these diseases much a lot. So I'm trying to make you clear all these points to you so that you can keep these things in your mind, and you can further move on in your higher studies, giving the different kind of exams that need and all these things. For those exams, this will be helpful, so I'm giving you these lectures. So other diseases will come soon, and also that part 3 of ecosystem will also come soon. Till then, stay safe and goodbye.